Now, we told you about the big conversation. It's following Kwete investigations, and already that investigations here have revealed that the Ministry of Health under the John Dramani Mahama administration spent a part of a government loan facility on research into the chances of the party. That's the NDC. The research was conducted by UK-based SCL Social. It is the mother company of Cambridge Analytica. You know, that company that was involved in all that stormy controversy on the elections monitoring, etc. with Facebook. And our investigation also have uncovered how part of $175 million loan contracted to build some 7 hospitals across Ghana were diverted into the research. Now, let's bring back the story. And then we'll speak to Gabriel Benako of the Coalition of NGOs in Health, and also from anti-graft campaigner Edem Senano, who will be on stream, and he is with the Citizens Movement Against Corruption. Stay with us, watch the story. We'll be back with a great discussion.
When former President Mahama lost the 2016 elections, some members of the NDC blamed him. One of them is Roger Metonunu, who said Mr. Mahama dismissed crucial campaign intelligence provided to guide the election strategy of the party.
We did a lot in our own way. I have a group of people who are extremely committed, and we carried out research. We did a 32,000 household survey across all the 10 regions of this country, identifying attitudes, behaviors, perceptions, and desires of the people of Ghana. We put the report together, and either the report
didn't find its way to the presidency?
No, it did, but you know, sometimes people want to hear what they want to hear. Yeah, if you think you're winning and somebody comes and says, wait a minute, you're losing. If you want people who will sing his master's voice, you will not be heard. You know,
is that what happened in this case?
I believe strongly that our message, our research data was not accepted. It did not impact the strategy of the elections, and it was a disaster waiting to happen.
MP for Dododiodio and member of the Mahama campaign team, Neelante Vanderpoy, said the report was not made available to the party.
I'm not too sure about this research he's talking about, because as a member of parliament and with my position at that time in government, I should be privy if it existed and if it was really given out. That I should be privy.
So he lied
to that? No, I wouldn't say he lied, but I'm saying that I didn't have access to it. I didn't say it, and I don't know where it was sent. So when you do a research about the government, about the chances of the party in an election, then the research outcomes must go to the party so that the party will take steps to make sure that.
Then the party was detached, we're told.
No, I'm saying that even makes it imperative upon that group of people who did the research to submit their findings to the party.
But our investigations show the research firm was tasked to assess the performance of the NDC as well as investigate the relationship between Ghanaians and the healthcare system. Here's the exact wording of the contract.
The work consists of 2 discrete political and public health elements. The political element is testing the attitudes and perceptions of a population towards contemporary issues faced in Ghana and public confidence in the capacity and competence of the current administration to implement appropriate timely solutions, as well as the current level of satisfaction regarding the performance of the NDC at district, regional and national level is also tested, and the research incorporates how this may translate into future electoral success.
The research was a subcontract under a $175 million project awarded to British infrastructure company NMX for the construction of 7 district hospitals and an integrated IT system. SCL Social was paid $6 million to undertake a nationwide survey to provide data for proper planning of the healthcare needs of Ghanaians. The leaked files referencing then Deputy Minister of Health, Roger Metonunu, indicated the following, and I quote,
"The SCL Social team headed by Ceres Baylis delivered a high-quality product that was adapted to the specific cultural context of Ghana. The research undertaking not only responded to our needs, but also highlighted a number of issues that were initially not within the scope of the research.
According to the contract signed by the government of Ghana and NMS, Mr. Metonunu was the head of the project steering committee. An employee of Cambridge Analytica says in 2012, Ghana, among countries such as Guyana and Kenya, offered the firm election contracts. Cambridge Analytica was last year involved in data scandal with Facebook. Head of investigations at Channel 4 News, John Rapkin, who broke the Cambridge Analytica story in London, spoke to JoyNews about the role the data mining firm played when it was hired by Ghana's health ministry.
So when we were investigating Cambridge Analytica, we learned that one of their spin-off companies, which is called SCL Social, had a very large contract with the Ghanaian Ministry of Health, and they sent a lot of people out. They built surveys, and then they went all over Ghana collecting data and responses from people. And I understand that the whole project was paid for by the government of Ghana with taxpayers' money. And the suggestion was from people inside the company was that there was another motive to the project, which was it also, at the same time, it gathered the health data, but it also gathered very important data that could be used later in an election for political purposes.
Now, we have here to help us start the discussions, will also be joined on stream by anti-graft campaigner Edem Senanu, but Gabriel Benako is here. Good morning to you. He's the national chairman of the Ghana Coalition of NGOs in Health. Good morning to you.
Good morning.
And what do you make of the story? What have you made of it since you got wind of it?
Was quite surprised and also some kind of mixed feeling. It's true, it's not true. How did this happen? And what accounted for that to happen? And what is happening to our political landscape? Our politicians are playing with the life of people in Ghana. They flout laws without knowing when the laws will catch up to them. And this is not just to only the previous NDC, it cuts across all political parties. Even right now, it's also still happening. So the coalition position is that there should be a cleanup at the Ministry of Health. We want to call for the president to clean up the Ministry of Health. The reasons are from 2012 till June this year, there has been a lot of happening, and the health workers, especially the ministry, the political leadership, have always had a laneway. Anytime there are issues about misappropriation, allegedly, or anytime there are issues concerning about health workers' rights and responsibility, or anytime there are projects to be executed or to be implemented or to be managed, there are always critical issues being influenced by political leadership. So we are calling for a total cleanup of the Ministry of Health.
Now, just by starting the whole conversation perhaps on the right note, for you and where you work and your partners, how important is the absence of proper stakeholder consultation in the way contracts are awarded, are even executed? And even before we come to all that, how we think through before we start up these projects, how are the absence of such consultations perhaps leading to some of these findings, for example, as we found in Kwete Nate's report?
Yes. First of all, I see, and having worked closely with the Ministry of Health, we are a member of the Health Sector Working Group. We belong to a lot of subcommittees. They do so many things with impunity without regards to the necessary administrative and legal processes. And that is why we are calling for a cleanup, because that has been the major issue. Even sometimes when civil society are supposed to be well represented so that they can see the other side of the story and prompt them, they try to hide. So you are only called in to make up the number. You are only called in to just see what is happening. And sometimes it's difficult for you to have access to a document and you can easily make an input to it before approval. So you see that civil society are always seen as destroyers or detractors or unnecessary causing panic, rather than looking at the other good aspect of civil society, playing a watchdog role, playing an accountable role, and also facilitating the issues from the community to be put into planning. And that is why the Coalition of NGO in Health is calling for a total cleanup at the Ministry of Health since 2012 till June this year, so that we can have a clearer picture of what has happened. But on this issue specifically, I think that it ought to be dealt with immediately. Let's get all the stakeholders to verify. Let's get the contract. I don't have access to the contract document, so I'm only talking based on the initial publication and some few interaction and publication that you have already made. And I think that we can pursue it to the letter to ensure that this time around, civil society will play a critical role in supporting the independent inquiry that should happen.
At the end of the day, we know that there are people who are supposed to be responsible, whether appointed by the president or a political party or public office holder because they belong to the party in government, etc., who are supposed to play the roles, as it were. How does he talk about the responsibility, and then how they need to make sure that that responsibility to the citizenry is well executed?
Yeah, you see, the reason why I'm calling for this is that when a political party is in government, any other issues with the party should not have any influence on the government. There are clear guidelines, there are clear rules to that effect. So when you see a government taking advantage, using the political structures to use the public resources to take undue advantage, one, it is corruption without any, we don't need any definition about corruption. It is a pure corruption practice. When a party in government is using some resources to support its political mechanism to give an advantage to the party in government, is totally wrong. That's the first point. The second point is that there are clear administrative procedures as to how political parties should be financed. The Electoral Commission guidelines are so clear, but we find political leaders playing a role that make the party in government taking much more advantages than any other opposition party. That is also wrong. So whichever way you find it in this story, it is totally wrong. The other issue is that there should not be a state fund to help a political party collect data and use that data for its advantage or otherwise. That is also wrong. No matter how leaders, previous leaders or current leaders explain, it's also wrong. And it's also happening now. I'm going to give you some examples of what is happening now. So what we need to do is civil society to collaborate with the media and anti-corrupt agencies to create a platform to warn political leadership of how they misuse the taxpayers' money for their advantage in preparing to become political party in leadership.
And you have interacted with various officials or heads of the Ministry of Health and their allied agencies. How easy is it, and because we've seen this, that something has been able to be, I would say, smuggled into a document for specific terms of reference activity? How easy is it for some of these actions, intended purposes of improving the health system, to be manipulated, as we've seen in this case?
It is easy because we have not respected our structures. It is easy because we have not implemented our regulation as to accountable governance. It is easy because we have a whole lot of people surrounded by government who take advantage to influence government in a way, so-called advisors who inform the president or the political leadership that this is the way to go and that they must get some resources from programmatic funding to support their agenda. That's why it's easy. But it is not easy because we should be able to finance our structures and we should be able to stand by ensuring that every agency within the Ministry of Health should ensure that they have well-represented civil society so that they can give them the yellow and the red lights before they even commit the crime. I'm saying this because, let me give you a typical example. The Ghana Coalition of NGO in Health is doing a project with the Ministry of Health, Ghana Health, on immunization. Because of the way we have been recognized in terms of civil society playing a demand generation, a referral, and public education role, immunization is doing well in Ghana. Our coverage is getting better and better. Right now, tomorrow, from tomorrow till next week, 17th to 22nd, the Ghana Coalition of NGO in Health is helping the Ghana Health in 201 districts to ensure that we educate the public for them to get their children between the age of 9 and 59 months immunized. That is the impact of when we open up for civil society to play their watchdog role and their educational role. The other aspect, they keep them to themselves. And you and I know, Roland, that when you have information alone, you become more powerful than your competitor. And therefore, you use the information either rightly or wrongly for your parochial interest. And that's why we are calling for that we should move away from that by getting a proper documentation of what has gone on, good and bad, from 2012 till June 2018.
And we have anti-graft campaigner Adam Senanu on stream. He's joining us via Skype, and he is with the Citizens Movement Against Corruption. Good morning to you, Mr. Senanu. But more to the substantive issue, you get to find that this is an action that has been undertaken within a certain mainstream activity. So there's a due contract, legally binding, legally maybe procured, etc. But then there's a certain line item that is indicating that an item on the TOR or terms of reference is giving due advantage to the government of the day, more so the political party that is forming government. What do you make of it as far as all the discussions and the issues are with anti-corruption?
Well, good morning. It's actually surprising that anybody would have to develop a line item that is specific to a political party. I mean, I am a development consultant, and we do a lot of work where you can ride on the back of an existing research work to collect information that affects various aspects of government. And one would have assumed that this is just what they would do. There wasn't really a need to then pull out and say NDC, as long as it focused on the government. And that is what one would have expected that they would focus on. And so it's really surprising that they had to have a line item that is, as it were, given to this particular activity.
Now, here lies a case, the document in question, the contract document passed through Parliament, went through a committee of Parliament on health. Perhaps maybe that line item about the research involving the NDC and the perception about the citizenry or the communities involved or the household on how well government was performing was not in there. But do you think perhaps proper scrutiny also could have been made at that level?
Absolutely. It means that people are not paying attention. Because like I said, I mean, there's nothing wrong with asking a question. One single question could be, how do you view this particular policy of government? And once you've asked that question, it tells you what people think about government. So there's no need to have a line item attributable to a particular political party. What that suggests is that that line item could be hived off to do other things rather than be part of the broad scheme of things. So the fact that nobody paid attention to the fact that we had NDC there is quite surprising, because you can't use money that are borrowed for the collective for a particular line item that can be attributable to one particular partisan interest. And so somebody didn't do their work well. I doubt that if it had been noticed, it would have been passed in that same form.
But this speaks volumes, especially your response. It means that we could have well laid out and worded contract documents with well laid out terms of references, but they could mean different things, and they could be subject to manipulation by the government of the day.
Yeah, it happens all the time. I remember in the JIDA scenario, when we got into the nitty-gritty, we're seeing costings that had, I always like to say, Wellington boots and wheelbarrows changing every month. They're replacing their Wellington boots and wheelbarrows every month. Nobody in their right mind will pass that type of contract, because you know that the lifespan of a wheelbarrow or a Wellington boot cannot be 1 month. So yes, when you get into the nitty-gritty of it, people can pass things that are outrageous within the broader framework of a contract. And it's important that those who negotiate and conclude on the contracts at the national level pay close scrutiny as to what is being written and what has been put down.
Well, please stay on the line. Let me just get back to Mr. Gabriel Benako here. But it also means that a lot of things may have gone under the carpet, unnoticeable, so to speak.
Yes, so long as we are not committed to accountable governance, all the state funds and credit facilities we pick, we will continue to misapply them, because the mechanism to support government to be much more proactive and much more transparent are not recognized, and they are not encouraged. Therefore, I'm waiting to see where the media will be given the opportunity to have the opportunity to make an input into the budget, how budget is spent, apart from your normal investigative activities. I'm waiting to see where civil society will have that clear slot to make input and analyze, and be asked to analyze the budget and give their consent to how we will use state funds or credit facility. I'm waiting to see how government will be able to leave their political parties to do their own kind of thing and focus on discharging their duty as the reasons why they were voted into power. These are clear, critical things that we need strong commitment of our parliament to open up for that. The Parliamentary Select Committee ought to be much more proactive than before, rather than we are the majority. Everything about it, we find ways and passing it through without allowing the other side. You know, the minority always have reasons why. There are wisdom in whatever the minority says. It's not only the majority that carries the vote. We have been brainwashed by knowing that the majority carries the vote. In my practice as an organizational development consultant, qualitative information may not be majority, but it counts. And therefore, government need to be much more aware of why the people put them into governance. Otherwise, we will continue to have this kind of thing. And because they hold on to so many powers, sometimes it's very difficult until this happens. Until when you are able to discover this. Nobody knew this until now. And it has already happened. A lot of health facilities that could have been built have been denied. A lot of women and children who should have access to more health services have been denied. We are still stressing out the health systems with the small resources that we have, instead of expanding and creating more accessibility for people because of some of these unwarranted activities and behaviors. The health system continues to suffer, and that is uncalled for.
But Mr. Senano, we have, let's say, the coalition of NGOs in health, so to speak, and we'll call them stakeholders. They are civil society too. But at the end of the day, we have other stakeholders like hospitals, the groupings that tend to represent the hospitals and the other health professionals. What will be your comments then when it has to be suggested that perhaps we need greater consultation either in the future or from now in the execution of such projects and contracts, so to speak, so that there's a certain buy-in and everybody is well in their minds that the right things are being done?
Yes, you are right. And indeed, there is a policy framework. It's called the Popular Participation Policy Framework for Ghana, which requires that government at all levels provides regular platforms where other stakeholders can engage, understand the policies that have been implemented at that level of government, can give their input, and can hold government accountable in terms of the reviews. So if it's a quarterly platform, whether it's at the Ministry of Health level or the district health level, the citizens as well as key stakeholders like the coalition of NGOs in health or which other sector we are dealing with will then, as it were, have an understanding that, look, we are currently implementing 12 policies. Of these, 5 of them are 50% done. These are the particular activities being rolled out in these particular communities or districts. And then they can get the feedback because you will have citizens who have an experience of the particular policy coming back to say, well, this aspect of the policy is not working. We think this is a waste of money. And it will then require policymakers, implementers to review the policy because policy is not static, it is dynamic. We have seemed to be in a position where for most of the part we just execute things and the same policy is run without the input of the stakeholders. So you are absolutely right that we cannot continue this way. Ideally, the stakeholders ought to be the ones giving feedback as to whether what you're doing is right or wrong. And that will allow better transparency and accountability in what we do.
But you know, using a whopping $6 million for research, how was that a graft or anti-graft issue in the first place? And what gap, as in what vacuum does it create in the first place, as far as all the issues we have to put in perspective of embezzlement and misappropriation? We
say corruption is the abuse of entrusted power for personal gain. Whenever you're giving power or authority on behalf of the collective, and as it were, you take advantage of that to have something that benefits you or your constituency or the people that are close and near to you, then there is corruption. In this case, there appears to have been a situation where monies that should have benefited all Ghanaians, irrespective of their political coloration or background. Now that money, a portion of it, a substantive portion of it, has been diverted for a particular political interest. That is corruption. So clearly, there is a conflict of interest for whoever supervised or spearheaded the process that then, said we are allocating part of these monies that should benefit all Ghanaians for a particular interest that does not benefit all Ghanaians. The amount involved is, for me, quite phenomenal. I would say gargantuan. And I mean, one would want to see the instruments they used. What were the questions and what was the scope? How many districts, how many people were covered? A little bit more of investigation as to what did they actually do on the ground to deserve or to even think about it. Because it appears to me that, for all you know, part of that money, assuming that the facts are true, has been diverted elsewhere. And so there are many more questions to be asked. And it certainly is a clear case of corruption to the extent that this money went on focusing on one political party that does not actually represent all Ghanaians.
But, Mr. Benako, 6 million. within the perspective or the context of infrastructural provision in health, what could they have done?
It could have been able to construct 12 more health centers, 12 more health centers or polyclinic, and given the situation in Ghana, we have always had in the hard-to-reach district, you have over 150,000 people patronizing one polyclinic. So multiply 150,000 people by 12, and you will see the number of people that this 6 million would have been catering for if we were going to use that to improve on 12 polyclinics to become fully fledged district health facility.
You mean the structure for a polyclinic?
Exactly.
500,000 Ghana cedis can build a structure?
Yes. Even less. Civil society are doing it. We can even give more than less than 200,000 to help provide an infrastructure, which is later on absorbed by the Ghana Health and they upgrade it. So if you have polyclinics, you could have at least 2.5 million Ghana cedis. That will help upgrade a polyclinic into a district fully fledged hospital that can take care of over 200 or even more people. And that is telling you that we are playing with the health of the people in Ghana.
Well, at the time, the exchange rate was 3.5. So
okay,
it gets to read about 21 million Ghana cedis.
Exactly. So 21 million by 12, it can tell you what it can,
by 12.
Exactly. Can tell you mathematically what it can do.
Mr. Sananu, is it that the politicians or those who make such decisions are oblivious of maybe their actions and how impactful, if they took the right actions, their decisions would have been on the sectors that they supervise?
I think you know the answer to that. I don't think that any politician is oblivious of the impact that they are having in terms of the negative, the negative consequences of taking away money that ought to be benefiting the poor and the struggling Ghanaian. Somebody said it a few weeks earlier that political party financing is one of the root causes of this. People are in a hurry to pay back the money they borrowed, and not just that, they are interested in also making their own, profits off systems that are not being supervised well. So they are not oblivious in any case. I think that civil society and media working in partnership ought to be the champion of ensuring that the right thing is done at all times. Anytime we allow the politician to have his way in deciding what should be done and nobody scrutinizing what they are doing, believe you me, the likelihood is that somebody is going to try and make some money off the system. And so the rest of us as citizens, we say that the cost of thriving democracy is eternal vigilance by the citizens. There is no way democracy can thrive in Ghana if citizens represented by civil society and media do not continuously engage and keep their eyes open in terms of what is going on.
But now we're being told the special prosecutor has taken a keen interest in the case. Well, he wants our team also to furnish his office with the right documents that will make this admissible, or perhaps can refine this enough for proper investigations. In what way, as a first step, should he be proceeding?
Well, I mean, I think that the fact that you already have documentation that does go beyond the fact that it was a government piece of research. And that was interesting for me because I do impact assessments, baselines, etc. And in my mind, one or two additional questions on an existing research, we always do. I mean, election times, I have the habit of putting one or two questions on top of any of the researches we are doing across the length and breadth of Ghana. And usually it's able to tell me what the people are thinking and where the focus should be. So there was no need absolutely for a distinctly separate research focusing on NDC to get the information they wanted. That makes me even more suspicious. And that is why getting copies of the research reports, getting copies of the instruments to look at the questions that were asked on the ground, understanding who was involved, all of that will give us a good sense of, was this actually done? Where did the money go? Were the questions clearly partisan? And that itself will tell the story and allow it to be admissible in court.
Well,
there's no way you should have a question that has NDC, and it does not reflect all the other parties that were competing at the time. That tells you that, yes, this was something that was, as it were, pulled out of the main research work and tailored specifically for one group of people.
I'm also, Kwete Nati, the lead investigator for this whole story, tried to draw the link or the synergy between the initial utterances of a former Deputy Health Minister, Roger Matununu, who also happened to have been the project lead on this, about how the party had, or he had commissioned a 32,000 house survey to indicate or gauge what Ghanaians were thinking about the performance of the government, and that would be a guide into the elections, etc. And then him coming back to say that, well, there was, following a statement he issued, it has no link at all, there was no involvement by him to do whatever it is. What does it say in the first place? And then add, the contract document to Parliament doesn't state explicitly that the research is supposed to look at these so-and-so questions in relation to the NDC. So what we have quoted in the report is actually the intercepted document of Cambridge Analytica we know had been involved in that scandal. And that's what it is. One party, either accused or not, or involved, could deny because it is just an intercepted document. Nobody can hold that to be a true fact, can they?
Well, I think that the fact that what you intercepted categorically states that this was done to get a view on what citizens felt about the NDC is sufficient ground for an investigation. The thing is, as you yourself have said, all the other generic documentation may not have said this. But when you get to the operational level documentation, you then begin to discover documents that tell you the story. And so I understand what you're saying perfectly. You can have contracts that hide the facts on the ground. But as you get into the additional documentation, and this is where the special prosecutor has the power to demand documentation. One of the reasons why the sub-legislation on his office needs to be passed quickly. And that additional documentation would then give you all the additional evidence to say that, okay, so what you intercepted has actually been validated and verified by that. So yes, there is every ground based on what you intercepted for someone to say we need to begin an investigation to find out if indeed this particular piece of research was hived off something that was for the people of Ghana to benefit the interests of one party, as in this case, the NDC.
Yeah, so my point again, and as we have to add up, we could end up having the special prosecutor look into this, but it's just going to be so-and-so and putting one or two together and drawing a certain conclusion. But whether that could be admissible in court is another thing. I don't know. You and I are not lawyers, so perhaps...
I think that the special prosecutor will be so minded as to demand from the Ministry of Health the approved instruments. What did they use in the field? Once you get the instrument, and the instrument I'm talking about, the questionnaire, the questions by themselves will tell you how partisan this was, and that should be good enough evidence.
What if that part of the questionnaire, or maybe those range of questions were not part of the mainstream questionnaire? I mean, you know, people could be evasive because this one was not explicit. Bad things were being done, so nobody will come forward and say that we did the bad thing. I mean, that's all that I just want to posit here. But look,
yeah, well, that's a risk.
You get my drift, don't you?
Yeah, I do, and that's a risk we take as civil society and as anti-corruption activists every time we take up cases like this. We are hopeful that some patriotic citizens somewhere having additional information, and definitely there will be, will also, as it were, volunteer the additional information to make our case watertight so that we can, as it were, establish what exactly transpired.
Well, you're right. You're right. There's always a chicken and egg situation in this fight against corruption, because nobody steals money or does wrong and physically or visibly leaves a trail, so to speak. It's when you dig deeper, you look at the coincidences and how things don't add up. That's where you get to the point. But for you, how are you going to complement this and also going to show the bodies or the authorities that will be willing to investigate this, that this is just one of several misnomers that we have in our body politic or our governance structure?
Yeah, that's why if you look at my initial comment, I said that we are calling for a thorough investigation into the matter. So what we are going to do is we are going to furnish potential corrupt practices or mismanagement of some funds from 2012 till June 2018. We are going to do that, especially this latest story. We will liaise with you, Joy, to also see what you have and what we can add up to that. That's critical. The other most significant situation, Roland, which we miss out in all this conversation and discussion is that the development partners who support the country with either grants or credit facility or a hybrid of that have always supported government without strengthening civil society capacity to play their watchdog role. And I keep on saying, development partner, your approach is wrong. Without any hesitation, development partner, this approach is not going to help us deepen democracy. If only they believe in democracy and they want to support Ghana to strengthen our democratic governance and accountability, they should create much more fairer opportunity for civil society to begin to be capacitated to play that watchdog role and leaving some percentage of funding to allow civil society to have the capacity to play that role. That is another critical thing. The other issues I need to talk about is currently there are interventions going on in the country that are also not supporting or creating an opportunity for media and civil society involvement. There are interventions going on in the country and they don't even have policy, but they are implemented. If you don't have a policy and you are implementing, Roland, what are you implementing? It becomes sentimental. Because
you're saying that if you don't have a policy, it means guidelines as
exactly.
to appropriations and things like that.
You don't have a guideline, and I'm challenging Joy to begin to roll out. There are interventions now rolling out in the country, and we don't have policy guidelines. And that call for potential corruption.
Like what?
Like planting for food and job. We didn't have a policy for over 1 year, and we are implementing. We have one district, one factory. We didn't have a policy for over 1 year. Now they are saying they are developing a guideline, like what do you call it? One village, one dam. What is the policy? You see, constructing a dam or a dugout has health implication. Yes.
How?
Mosquitoes and other flies will be bred there, and when they are bred there, the people in the community will have health implications. So the flies, the mosquitoes, and other diseases, find out in your research. You will see that
dams.
Anywhere we have dams, you must put in place an emergency plan in addition to the dam.
I grew up in Asham, we have a dam.
And what happened? The people around the dam find out what diseases they had.
Okay, I think the point about disease, you have a point there.
Yes, so that means that we need to have a clear policy about what we want to do.
And you are worried about that.
Yes,
thank you very much.
Is very worried about that.
Gabriel Benako is with the Coalition of NGOs in Health, and thanks for your time this morning.
Thank you too.
It's been instrumental helping us with the discussions. Again, know that we'll bring you more unfolding stories in this great investigations by Kwete Nate, and he's the lead investigator that is indicating that some part of $175 million that was supposed to have been used for the construction of some 7 hospitals apparently was diverted with around $6 million to do a research, and in that research component was also to gauge how citizens in some 32,000 households thought about how well the NDC was doing, etc. It was just in the run-up to the 2016 general elections. Well, we'll bring you more on this.